Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Thyroid hormones and their physiological effects. So we'll be covering this with systemic wise. So first is we look at the CVS. So in terms of CVS, there is a chronotropic as well as a inotropic actions. There is chronotropic. So there's presence of the chronotropic as well as the inotropic. So chronotropic and the inotropic effects. So what do we mean by this? So under this there is an increase in the beta adrenergic receptors. So increase in the number of the beta adrenergic receptors, and there is also the increase in the response. There's increase in the response to the circulating. So increase in the response to the circulating catecholamines. And there is a increase in the proportion of the alpha myosin heavy chain. There's increase in the proportion of the alpha myosin heavy chain. Then in the cardiovascular change, there is a decrease in the PVR. So PVR means the decrease in the peripheral vascular resistance, and compared to the blood volume, it increases. The blood volume, it increases. That is, there is activation of the RAS. Now let's move on to the musculoskeletal system. So in case of the musculoskeletal system, there is a catabolic action. There is presence of a catabolic action. That is, there is a presence of the breakdown of the protein. So there is a breakdown, and this is going to be of the protein. So the next is that it promotes the normal growth and the skeletal maturation. It also helps in the promotion of the normal growth. So this promotion of the normal growth, as well as there is a skeletal maturation which is seen. Skeletal maturation. Now we move on to the nervous. So under nervous system, it promotes a normal brain development. So the normal brain development is taken over. Then looking at the GI. GI stands for the gastrointestinal. So the thyroid effect is that it increases the appetite. So it increases the appetite as well as the food intake. And other thing it does is it increases the GI motility. So the GI motility is increased. Next, we move on to the respiratory aspect. So under the respiratory, there is a total increase in the respiratory rate. So thyroid hormone, it increases the RR, that's the respiratory rate. Now let's look at some other miscellaneous systems. So under the other conditions, we look at the carbohydrates. So in terms of the carbs, it promotes the uptake of the glucose into the cell. So it increases the glucose. So it promotes the uptake of glucose. So we can write it as promote glucose uptake. So it promotes the glucose uptake, that is, increases the glucose into the cells. So what does it do? It increases the insulin. So it increases the insulin secretion, and then it also contributes to the increase in the gluconeogenesis. So it is gluconeogenesis is also done. Next is the presence of the increase in the glycogenolysis. Glycogenolysis is also done. So increase in gluconeogenesis, the increase in the glycogenolysis, and the increase in the insulin secretion. Next we look at the lipids. So under the lipids, there is a catabolic action. So under lipids, there is a catabolic action. There's presence of a catabolic action. So by catabolic action, it is nothing but it stimulates the lipolysis. So the stimulation of the lipolysis, and there is a decrease in the LDL. So the LDL, there is a decrease. That is the formation of the LDL receptors. There is formation of the LDL receptors. Now when you're looking at the calorogenic. So under the calorogenic, it increases the BMR. So BMR is nothing but it stands for the basal metabolic rate. And then we look at the thermogenic. So thermogenic means there is heat production. So there is heat production. To learn and grow daily like this, please do subscribe.